come right this way.
Okay.
So I just got done washing my hands. My name is Vicki. I'm going to be doing your physical exam today, which we have prior received consent for. Is that correct?
That is correct.
Excellent. I'm just going to have you confirm your first name and date of birth.
Sure. My name's Aaron, and my date of birth is January 18th, 1988.
Perfect. I'll have you step right here on the scale.
165.
Excellent. And we're just going to get your height here.
Okay.
Good. Almost 6 feet, 5'11".
All right.
Does that sound correct?
Sounds correct.
Excellent. I'll have you take a seat right here in our chair. I'm going to grab a set of vitals. First, I'm going to get your blood pressure, and then I will get your heart rate, your temperature. We will go from there. And I just have this arm. Now, when you feel this squeezing, just keep your arm nice and still, okay, Aaron?
Okay.
Excellent. Go ahead and get your temperature while we're doing that. There's a clean probe on this. (117/77), and I have a temperature of 97.2.
Perfect.
Slip this right off. I'm just going to check your pulse. Perfect. Pulse of 62, respirations 18, which we assess while we're doing the pulse so that the patient doesn't alter their respirations. Just going to grab a couple pieces of equipment to bring over with me. Okay, perfect. All right, so I'm going to start by assessing your head and eyes, ears, nose, mouth, and your neck. So I know that sounds like a lot, but we'll start with the head. I'm just going to start by inspecting your hair. And I'm going to palpate the scalp as well, looking for any areas of depression that could indicate previous head trauma. Any tenderness?
No tenderness.
Good. I'm also inspecting the hair for lice or anything like that. And then I'm just going to look at the patient's skin, assessing for any flushing, pallor, any other discoloration, hair distribution, especially in a female, any lesions, moles, anything like that. Everything looks good. Now I'm just going to assess your eyes. I'm going to have you just look straight up to the ceiling if you can. Good. And I'm going to have you look down. And here we're just assessing the color of the conjunctivae and the sclera. Now I'm just going to assess your pupillary reaction too light here, so I'm going to have you look straight at my nose. Good. Ideally, all of the lights would be off in the room. We can't really help natural light. But your pupils are reacting equally on both sides, so that is excellent. Next, I'm just going to have you open your mouth for me. And I'm going to take a look at your tongue, the roof of your mouth, your teeth. I'm just going to lift your lips up a little bit. Good. I'm going to depress your tongue. Say ah.
Ah.
Good. I'm looking at the pillars, the uvula, the pharynx. No exudate back there. Now I'm going to have you lift your tongue to the roof of your mouth. Good. To the side. Teeth look good. To the other side. Good. All right. Now I'm just going to palpate your temporal mandibular joint here. So I'm just going to have you open and close your mouth for me. Good. One more time. Good. I'm just going to palpate the muscles. Excellent. Do you have any tenderness here when I push on your sinuses?
No tenderness.
Excellent. I'm just going to have you tilt your head up slightly so I can just assess for any septum deviation. Your nose. Good. And I'm just going to look in your nose and visualize your turbinate. Nasal mucosa pink. Good. Good. Let me just wipe this off for you, and then we'll take a look into your ears. Okay. Eardrums are pearly gray. You can see the malleus and the cone of light. Perfect. A little bit of wax obstructing us there, but that's okay.
Okay.
So now we're just going to test your hearing. So what I'm going to do is I'm going to use this tuning fork. I'm going to hit it for the vibration, and I'm going to put it right on top of your head. I want you to let me know if you hear it equally in both ears, and then we'll move on to a second test, okay?
Okay. I hear it equally.
Good. So for this second test, I'm going to hit the tuning fork again. I'm going to place it right on your mastoid process. You're going to tell me when you stop hearing it, and then I'm going to pull the tuning fork forward. Tell me when you stop hearing that, okay?
Okay. You don't hear it? I don't hear it.
Good. And we're just timing this while we're doing it to ensure a normal response, which is air conduction is longer usually than bone conduction.
I don't hear it. I don't hear it.
Excellent. All right. So now what I'm going to do is I'm just going to palpate your lymph nodes. And I want you to let me know if you have any tenderness while I'm palpating.
Okay. No tenderness.
Good. I'm just going to palpate both of your carotid arteries. one at a time to make sure we don't obscure blood flow. These are nice and strong. I'm just going to take a listen to make sure that I don't hear any bruit. Good. Okay, so what we're going to do next is I'm going to have you take a sip of this drink. When you take a sip, I'm going to have you hold it in your mouth just for a moment and just wait until I tell you to swallow. I'm just going to be assessing the thyroid gland, checking the contour and symmetry, which can be seen during the swallow. After we do this, I'll have you repeat the test when I'm behind you. Go ahead and swallow. Excellent. Now let's have you repeat that test. Palpating for the thyroid isthmus. Good. Are you all done with your drink?
Yes, thank you.
Okay, so now what I'm going to do is I'm going to test your neck and jaw range of motion. So I'm going to have you start by touching your chin to your chest. Good. And then tilt your chin up to the ceiling. Good. Come on back. Now I'm going to have you turn your head from side to side. Good. And then try to touch your ear to your shoulders. Good. And now for your jaw, I'm just going to have you try to protrude your jaw forward, your bottom teeth forward. Smile, honey. So I can see it. Good. And you can go side to side. Good. And can you go backwards? Good. All right. Excellent. I am just going to now assess for your cranial nerves. So I'm just going to grab some supplies from over here. The first one that we're going to do is testing your olfactory cranial nerve, which is smell. I'm just also looking for my Snellen eye chart, which will test our second cranial nerve for visual acuity. Which I apologize, I thought that was right up here. There we go. So we'll have this here for you. Okay, so again, cranial nerve number 1 is just going to be testing smell. So I'm going to have you close your eyes. And I'm going to put something under your nose. I'll tell you what to sniff. Sniff.
Cinnamon.
Beautiful. Now this here is our version of a Snellen eye chart, which again is going to be testing cranial nerve 2 for visual acuity. I'm going to hang this up over here for the patient to view from a distance. Okay, so I'm going to have you cover one of your eyes. Good. And now I'm going to have you read just this second line here if you can.
P-N-U-N-T-D-Z.
That was very close. We were one letter off. I'm going to have you go the next line up.
D-F-N-P-T-H.
Good. And now we'll have you cover the other eye and start with this line right here.
P-N-U-N-T-D-Z.
Perfect. Again, just one letter off. Let me have you go the next line up.
D-F-N-P-T-H.
Good. So we're getting 20/30 vision on both sides. Now we're going to test cranial nerves 3, 4, and 6 with some extraocular movement. So what I'm going to have you do is follow my finger. Now I'm going to have you look at my finger far away. And when you see a finger closer to you, I want you to change focus. Ready? Excellent. Perfect. So for the next cranial nerve, for cranial nerve number 5, we're going to test your motor and sensory response. So I'm just getting my sensory tools here. So the first thing I'm going to have you do is clench your jaw really tight for me. Good. Now the second thing I'm going to do is have you close your eyes. Before you do, this is a soft touch, this is a dull touch, and this is sharp. Okay, so I'm going to have you close your eyes and just tell me what you feel.
Soft, 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 soft. Sharp, 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 sharp. Dull, 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 dull.
Perfect. The next cranial nerve that we're going to do is your facial. So I'm just going to have you do that by raising your eyebrows for me. Squeeze your eyes shut tight. Good. Now show me all of your teeth, upper and lower. Good. Now puff your cheeks out for me. Excellent. Now I know the viewer may have a harder time hearing me, but we're next going to do cranial nerve 8, which is the acoustic. So that is going to be the whisper test. So I'm going to whisper something in your ear and you tell me what you hear, okay?
14.
Good.
28.
Good. So for cranial nerves 9 and 10, we've already assessed those just by listening to our patient's voice, by saying ah when we were doing their mouth inspection. And also, we would next do the gag reflex. We're not going to do that here in this situation because we're going to be nice to our patient, Erin here, but we would have already assessed those. So we're going to move on to cranial nerve 11, which is our spinal accessory. So what I'm going to do is I'm going to put my hand on your shoulders and I'm going to have you shrug them up. Excellent. And then for cranial nerve 12, can you just stick out your tongue for me? Beautiful. So we are going to move on from here. We have now assessed the head and neck. You have no pulsations, no masses, nothing like that. So we're going to move on to the back and thorax. So I'm just going to gather some tools here. So looking at the back, we're first going to observe our shoulder height of our patient, symmetry, chest expansion, and posture. The next thing that we're going to do is just palpate to make sure that there's no muscle or spinal tenderness. Any tenderness?
No.
Excellent. I am going to have you just lean forward slightly. Actually, why don't you come sit here facing this way so that our audience can see you. So the next thing that I'm going to do is palpate with a thumb for CVA tenderness. CVA tenderness, any tenderness?
No.
Any tenderness?
No.
Excellent. If there were CVA tenderness or if the test were positive, that would indicate kidney inflammation. So that is why we look out for that. The next thing that I'm going to do is palpate for tactile firmitis. So I'm going to have you repeat 99 over a couple of times until I tell you to stop. Not too quickly, okay?
Okay.
Go ahead.
99. 99. 99. 99. 99. 99.
Excellent. Now I'm just going to percuss the lungs. For which normal would be all areas resonant. So far, so good, Erin.
Good.
So next what I'm going to do is I'm going to have you exhale, and I'm going to locate the area of diaphragmatic dullness. So again, with percussion. So go ahead and take a good deep breath in and then exhale. You can take a deep breath. You can breathe, I should say. All right. So next, just so that I can measure the expansion, I'm just going to have the inspiratory excursion. I'm sorry. I'm going to have you take a big deep breath in and hold that inspiration. Okay. Breathe. I'm measuring just below 4 centimeters, so that is perfect. Let's get rid of this. Next, I'm just going to take a quick listen to your lungs. I'm just going to feel for your chest expansion here. So go ahead and take a deep breath. Deep breath. Excellent. While I'm listening to your lungs, I'm just going to have you continually take deep breaths in and out. I'm going to move my stethoscope across your back, but just keep taking those deep breaths until I tell you to, okay? The lung sounds are clear in all areas. Perfect. I am just going to quickly listen to your lungs anteriorly and percuss, and then we'll move on to your upper extremities, okay? Deep breath. Excellent. Thank you. Good. We will finish up with the respiratory and cardiac assessment after, but we will finish doing your upper extremity assessment before I have you lay down, okay? So I am going to grab a couple tools and bring them over here. But first, I'm looking at muscle tone, muscle bulk. I'm inspecting the patient's hands. I would do both bilaterally. But I'm looking at the fingers for color to note any cyanosis. And I'm also going to check capillary refill, which is great. I will assess the radial pulse and the brachial pulse. Again, I would do this bilaterally. Relax your arm. Good. So next what we're going to do is we're going to assess for sensation, which is part of our neurological exam. And we will also do some deep tendon reflexes here. All So the first thing we're going to do, which probably seems a little familiar, we just did it on your face, is the dull, sharp, and soft sensation. I'm just going to have you put your arms out a little bit more for me. Perfect. Good. Close your eyes and tell me what you feel when you feel it.
Soft, 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 dull, 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 sharp, 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 sharp.
Good. Keep your eyes closed for me. I'm going to put something in your hand. This is testing for stereognosis, and I would like you to identify the object that I put in your hand.
This is like a penny or maybe a dime,
A coin?
coin.
Okay. Keep your eyes closed. I'm going to put something in the other hand.
It's a larger coin.
Excellent.
Quarter.
You can open your eyes. I'm just going to go ahead and assess your deep tendon reflexes, and then we'll do some strength and range of motion exercises, okay? Good. Just like this for me. Good. Good. All right, to assess strength and range of motion, we're going to do it on this side. We would do it on each side. We would do it bilaterally to assess that both sides were equal. For the sake of time, we'll do it on one side. So first, what I'm going to have you do to assess your strength is I'm going to have you pull your forearm using your bicep muscle towards you with some resistance. Good. Now I'm going to have you push your forearm forward using your tricep muscle. Good. Perfect. You can put that arm down. I am going to have you squeeze both of my fingers bilaterally so that I can compare. Good strength. Now we're going to do some range of motion. We'll start with range of motion in the shoulder. So what I'll have you do is lift your arm first straight out in front of you, and then up over your head, and then put it down. Out to the side, and up over your head, put it down. Reach across your body, come on back. Now put your arm behind you, like this, straight.
Okay.
Good. Now I'm going to have you hit your back this way and this way. Excellent. Now for your elbow range of motion, I'm just going to have you bend and extend. Excellent. And then I'm just going to have you put your elbow like this, straight at like a 90-degree angle here. And keeping this elbow nice and tight, see if you can just rotate your palms. Perfect. Now I'm going to have you hold this hand out. And to check your wrist range of motion, I'm going to have you, good. And then I'm just going to have you move your wrist side to side, keeping this nice and straight. Good. Excellent. Good range of motion, good muscle strength. So I'm going to have us move on just to you laying down for me. Are you comfortable?
Yes.
So this is as close to we're going to get to a 30-degree angle, which is evidence-based. It's recommended to do the cardiac assessment, including measuring the JVP. So I'm just going to grab some more tools here. We'll switch these out. I'll be right over, Aaron. So the first thing I'm going to do when I'm looking at Aaron is assess his chest, his work of breathing, his symmetry, which I will do again later when I have the patient ambulate. And I'm also going to palpate. We've already percussed. I'm going to palpate the patient's chest, just palpating for any heaves or thrills. I'm also going to palpate for the apical impulse here. If you have any trouble with this, you can have the patient turn towards their left side to bring the heart closer to the chest wall. But we have no issues here. Just going to have you turn your neck this way. Good. So now I'm going to go ahead and listen to heart sounds. I'm going to start with the aortic. Pulmonic. Herb's point. Tricuspid. And mitral. Excellent. Now we're going to attempt to measure the JVP using the sternal angle. I'm just going to have you turn your head this way. I'm getting less than 1 centimeter, which is excellent. Now I'm going to go ahead and move on to the abdomen. I'm going to start with listening for your bowel sounds. Active and audible in all 4 quadrants, excellent. Now I'm just going to use the umbilicus as a point here to try to listen for some through in the iliac arteries. And the renal. Non-nodic. And femoral. Excellent. Now I'm going to percuss the abdomen and try to locate the liver and the spleen. Dullness indicates the liver. Tucked right behind that rib cage. The hook method is commonly used to palpate the liver if you're not able to with one hand under the back. Just going to palpate the rest of the abdomen. Good. Not palpating the spleen. Palpating for the kidneys, which are usually pretty difficult to palpate. I'm not palpating them here. Next, what I'm going to do is palpate the abdomen very lightly. I just want you to tell me if you have any tenderness, and then we'll palpate a little deeper, okay?
No tenderness.
Good. No tenderness?
No tenderness.
Good. So we're going to palpate the aorta. Pulsation. Excellent. And we're just going to palpate the femoral arteries. Good. Excellent. So I'm going to have you go ahead and sit back up. So what I'm going to do now is I'm going to go ahead and assess the rest of your pedal pulses, and then we'll do range of motion. Actually, I'm going to have you lay back down for one more second. Range of motion in the hips is best done laying down, so we'll do that, and then I'll finish up with the lower extremities, okay? So to test range of motion for the hip, I'm going to have you grab your underneath your knee.
Oh, we've lost our pillows.
There you go.
Sure.
And pull your knee to your abdomen for me. We'll just do it on one side. Again, we would do ROMs bilaterally to assess for equals. Good. Can let go. All right, pull it towards you one more time. I'm just going to palpate for normal flattening of the back. Excellent. So now what I'm going to do is I'm going to pull your leg out. Keep your knees straight, please. Good. Knees straight, please. Good. And we keep one hand on the opposite pelvis to just observe that it's laying flat. You can bend your knee. Okay, excellent. Now you can sit back up. All right. So I'm going to start by palpating the patient's pulses. I am also, as I'm looking at him, I'm assessing if I can see any visual edema, what I can see for hair distribution, which, a lack of may indicate some peripheral artery disease. I'm looking for any wounds that might not be healing, ulcers, anything like that. That may indicate any issues. We're going to start with palpating the popliteal pulse. Good. Post-tibial. And the pedal. Good. Which again, we would perform on both sides to make sure that they're equal. For sake of time, we will do it on one side. I'm also going to assess sensation. So you're familiar with the dull, sharp, soft. So I'm going to grab those tools. All right, so I just want you to close your eyes for me and tell me what you feel.
Dull, 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 dull.
Good.
Soft, 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 soft.
Good.
Sharp, 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 sharp.
Good. I am going to assess for capillary refill on the toes. I'm going to have you lift your foot up. Again, I would do that bilaterally. Now I'm going to assess for proprioception. So I'm going to have you close your eyes and identify which way I'm moving your toe, whether it's up or down, okay?
Up, down.
Good. Again, this would be done bilaterally for part of the neurologic exam. I am also going to test your reflexes. Good. Excellent. So next up, we're going to do some ROMs, and then when we're done with that, I'm going to have you come over to the chair here, and you'll stand like this for me, okay? So let me just put these supplies back so you have a nice empty chair. Okay. So for ROMs, range of motions, I should say, of your knees, first I'm going to have you bend and extend your, perfect. Again, we'll do this normally bilaterally, but for now we'll just do this on one side to save some time. Next, what I'm going to do is I'm going to stabilize your knee, and I want you to try to move your leg from side to side. Excellent. Now just to check the ACL, I'm going to pull your tibia forward. Good, I don't note any protrusion. So next we're going to assess range of motion of the ankle. So what I'm going to do is I'm going to have you put your foot out like this. And I'm going to have you flex your toes towards your face and point them like a gas pedal. Good. Now I'm going to have you move from side to side and side to side. So limited range of motion in that ankle, and that is okay. Next thing I'm going to do is just test your strength before we change positions. So I am going to have you pull your calf back towards you against resistance. Good. And now push your calf forward against resistance. Good. Try to lift your thigh against resistance. Good. Again, this will be done bilaterally. And push your leg down against resistance. Good. Flex your foot towards your face against my resistance. Good. And down like a gas pedal. Excellent. All right, I'm going to have you come ahead and hop up here for me. So we're going to test sensation again with the sharp, dull, and soft objects.
Soft. Soft.
This would be how you would identify
Soft.
any diabetic neuropathy.
Soft. Sharp. 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 Dull. 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 Dull.
Excellent. Now I'm just going to test your reflexes. Good. All right, I'm going to have you stand up and come on and just stand right in front of the table here. So the first thing that I'm going to have you do is we're going to do some spine range of motion. So step in front of me just a little more. Perfect. I'm going to have you bend forward. And here we'll assess for scoliosis, making sure that everything is even and symmetric. Good. Now I want you to come back up and just bend backwards for me. Good. Now I'd like you to see if you can rotate your spine like this. Excellent. And now I'd like you to do some lateral bending by moving side to side, shoulder to the floor. Perfect. Next, what we're going to do is called the Romberg test. So what I'm going to have you do is stand just like this. I'm going to have you put your arms out to the side, or actually let's do it in front of you. So what I'm going to do is test for pronator drift and note whether or not the patient has any swaying, which would indicate a positive Romberg test. It looks like you did just fine. Go ahead and open your eyes. Now what I'm going to have you do is take a couple steps backwards. I'm going to have you walk as close to the camera as you can, doing a heel to toe motion. And then once you've gotten all the way to the camera, I'll have you turn around and walk on your tiptoes for me. Again, I'm noting the patient's work of breathing while they're ambulating and everything along those lines. I'm noting the patient's coordination, balance, all of that. There's just one more test that I'd like to do to finish up with your neurological exam and test for your coordination. So what I'm going to have you do is face me. What I'm going to do is I'm going to put my finger in front of you, and you're going to touch my finger and touch your nose. I'm going to move my finger. We'll start with this arm. Good. Let's do the other side. Good. Now just to assess rapid movement, I'm going to have you put your palms on your thighs and flip them as quickly as you can. Awesome. Okay, looks great. Well, thank you very much for your time, Erin. I think that completes our head to toe assessment.
Thank you.